Not too bad?
Mm-mm.
Just trying to open them up a little. I could see when I stretch. There's a good number actually under there. Some of them are whiteheads, some of them are blackheads. Trying to break the surface of some of them so that you can extract them, and then we'll put a little pressure on them. Good one. Yours are satisfying. You've been sitting around with these for a while.
Mm-hmm.
This one might be a little bigger. I can get it out. Sometimes they're tight under there, so I need to make another little nick in the skin. I'll come at it at a different angle. Sometimes when I do these pinch, sometimes people who watch these videos, they come back and say, "You forgot the one at 4 o'clock. Make sure you get that one, please." They're like begging me. So I try to get all the ones I can see here for you, so everybody's happy. That was a good one. I think that one is gone, right? Did I get that one really good, Christy? Do you know? Maybe not. That's still under there. If you need a break, tell me, because I'm just going to start pushing on you a little harder here to get the stubborn ones. See over here. There's one right under there. That's crazy in a crazy way. I know people just hate these things, and you know they're hard to get rid of. You need the right equipment to do it.
Oh, sorry.
No, you're okay. Let me see if I can get that bigger one here. Sometimes they're just, sorry, a little pressure there. They're like wider and not as deep on the surface, and we just gotta push them out. Oh, you're a tough cookie though. Sometimes parts of the sac, there we go. That one was still in there. We needed to come back to it. Say, you know, kind of like my husband does this too. If he doesn't like the way I'm answering a question, you back off and you come back at it in another direction. That's like what we're doing here. We're coming back at it in another direction. Giving it a little break. Don't like the way you answered that question. Don't like the way you responded. I'll back off and come back again a little bit later. See if I get it to behave the way I want it to. So we just made little slits right here.
Okay.
Wants to ooze a little bit, but nothing crazy, and it should heal just fine. There we go. See, some of them I just had to come back to a little bit. Nice. Not a lot smoother now. Now when I stretch the skin, just a couple here and there, but nothing crazy. Oh, look, there's more this way. You know, I might try to numb a little bit right here, because the pinch is not too bad, is it?
No.
Okay, good. You look like you're pretty darn tough. Get this one first, I think. One. There's a big one under here that's trying to evade me. I'm going to do my mother-in-law. This one to pinch a little bit more. My husband does that now though too. If he doesn't like the way I answer something, he'll kind of try to answer me another way, and I say, "Are you doing the mother-in-law crab?" You sidestep, you know, if you answer something, you kind of walk sideways and you come back again.
Doesn't work.
No, sometimes does. Hey, it worked here. A couple instances. There we go. Gosh, you got this all trapped under here. Look, it keeps on giving right here.
Mm-hmm.
Much smoother this one, I think, if I come this way. Oh, doing great. Sorry, dear.
It's all right.
Let's see if I can get this one out. Good one. Trying to get it all out of the same little area hole there. Good one there too. See if I can coax this one. No, it's a separate one. Won't come out of that same hole. Okay, let's try a couple more here and then we're good. These little ones right here. No, those are too, didn't make a big enough nick. Okay, let's do those. It definitely makes a difference when we stretch the skin. They're not as bumpy. There's that one right next to it that was not attached. And I love it when the patient is so agreeable, not jumpy. Our last gentleman that we did, of course, it's a guy. I love him, but he's a little more jumpy. We women are just happy to get rid of these. See, that's the, when I push there, there's a little sac under there that wants to come out. You see, if I do that, I can reach with my little hemostat, and we'll try to do that. Or at least make it friable. That's a little sac right there. Come here. Still hard to grab with my good pickups. But the fact that it's kind of there and I kind of tore it up a little, made it a little friable, means it'll come out. So I don't have to do that completely. One more one here. That's a good one there. Better stretch the skin much better. There's only one bigger one I want to tackle. I see on the side of your chin, but I'm going to numb you for that just to see if you think it's as much of a difference for me to do that. Did I picture this one? No, I can't remember which ones I poked. Okay, I think right now when I'm doing that, see if we can get that one out. There we go. Yep, it was a milia. There's probably still stuff in there. That one is a kind of, those are kind of flatter ones, you know what I mean? They're flatter and there's not much of a nodule under them. They're just wide and flat. So, you know, I have tiny little, you might have little, like somebody poked you with a little fine needle a little bit here. Not too bad. And I don't think, you know, even a little makeup if you wanted to cover it up, but that'll go away. And then you'll be much flatter and much smoother here, less cobblestone.
That would be